I'm Annalisa Samara, CEO of Rhaeos. I spent the past 17 years working with early-stage startups, wearing many hats, including venture capital and management. I was content with these supportive roles, but things changed when I came across this wearable that comes out of one of the biggest labs in the world, that has the potential to impact the lives of people like my friend Jane here, a gifted student and competitive swimmer. But something called hydrocephalus holds her back. What's hydrocephalus? Well, before I tell you what it is, let me tell you what it feels like. And it feels like a ticking time bomb in your head, caused by too much cerebrospinal fluid, or CSF, on the brain. And there's no cure for it. Left untreated, hydrocephalus can cause severe disability, including developmental delays, memory loss, and even death in some cases. The standard treatment is surgically implanted shunts that essentially drain the brain of this excess fluid that I was talking about. Now, this technology hasn't really changed over the past 50 years. And the problem with these shunts is that they fail almost all of the time due to things like infection, obstruction, dislodgement. And when this happens, another shunt needs to be put in, which means another neurosurgery. Not only that, non-specific things like headaches can bring into the ER. Imaging is used for diagnosis, but it's inconclusive, time-consuming, and exposes patients to radiation. After that, they're either sent home or they go into surgery for more invasive testing. And some patients undergo all of this unnecessarily because they're actually doing just fine. Now, this cycle repeats itself, and no diagnostic technology today assesses what's going on in the shunt accurately in a matter of minutes bedside until today. And that's where Rhaeos comes in. Rhaeos has developed FlowSense, a wireless, non-invasive diagnostic thermal sensor that is mounted on a patient's neck overlying the shunt to detect the presence and magnitude of cerebrospinal fluid flow. Now, it kind of looks like a Band-Aid, but in it are sensors that perform spot checks in minutes to detect flow or no flow and quantitative information on flow. Data is then sent to a mobile app. Clinical work has been published in Science and Nature family journals. And this work has brought us a lot of attention in the neurosurgery community. The device has even gotten the attention of the FDA, who granted us a breakthrough designation for the device. What does this mean? A faster path to approval. In terms of products, the first version of FlowSense will be a single-use disposable device for use in the hospital in inpatient and outpatient settings. The second device will allow for more remote monitoring at home. Now, hydrocephalus patients are expensive, and they're in the hospital a lot. FlowSense has the potential to change this by reducing costs, readmissions, and more. Now, while we're leading with hydrocephalus, we're not stopping at this indication. We have published work for our pipeline technology in other clinical areas and are already starting to build out that portfolio with major academic partners. To help us realize our goals, Rhaeos has raised over $8 million in dilutive and non-dilutive funding, which includes over $5 million in government grants and winning MedTech Innovator. In summary, Rhaeos has a platform diagnostic medical device that has been clinically validated. We have an accelerated path to FDA approval, are working with key opinion leaders across the country, and are on a path to market launch in 2022 with a team with deep medical device commercialization experience. Thank you.